So if you are joining me now, and you're listening, watching me live from wherever you are, please don't forget to share this video to your loved ones and friends so we all join. So I'm going to talk about something very important, and I think you're going to enjoy it. What I call the toxic culture. So share the link. Oh. Hello everyone and welcome to OPJ HUB. I'm so excited today that you are joining us. So I'm going to talk about something very important, what we call the toxic culture. And so if you are new here, please don't forget to share this video to your loved ones and friends. Toxic culture. I know when it comes to culture, they say culture is a way of life in a particular group of people. So particular group of people, how they live their life is what we call culture. However, I want to show you some toxic cultures that is actually happening in that we are actually calling our normal way of life, which is actually affecting us in so many ways. So that's what I'm going to talk about. So I want to share this video to your loved ones and friends so we can all get this understanding, so we can make informed choices and informed decisions that will help us as well. So share this video. I'm Dr. OPJ. We do everything health. So share this video. Let's talk about toxic culture. Yeah, keep on sharing the video. We are talking about toxic culture. And with these that I'm talking about, the toxic culture, a lot of people are actually indulging in this way of life in the expense of their future. Okay, so it's becoming a way of lifestyle. So they are doing it every blessed day. It's part of their life, not having a future in mind. And it's at the end that you realize that this was actually a toxic culture which affected their future life. So basically, once you're able to get the grassroots of it and solve the problem right from the way of living, then our future, other than that, our future will suffer because of the way of life we are living at the moment. So that's what I want to talk about today. So, can you mention any toxic culture in your community you think that has negative effects, especially on the health of people? Oh, all right, sure. So let's take a look at what the toxic culture is. So, in this context, I want to call it sacrificing your health. I mean, sacrificing your health for your ambitions, sacrificing your health for your ambitions. So, a lot of us have a lot of ambitions. You want to become the president of a country, you want to, um, you know, you want to be the this, you want to be the that, you want to be the so and so. And that is very interesting, it's very nice. Okay. But a lot of time, a lot of people kind of sacrifice these ambitions, no, kind of sacrifice their health in pursuing their ambitions. So let's say he wants to become the president of Ghana. He does not sleep regularly. He has to do a lot of campaigns here and there, moving from one location to the other, always stress. Maybe he has an ambition to become, the richest man in the world, or let's say the richest man in Ghana. Every day stressed about money, going up and down, chasing after loans, doing this, doing that, and he's not having time for himself to sleep or rest, right? Or sometimes when he has some headaches and other few things, we just take paracetamol and take it, or take some few painkillers, and then he or she is fine. And he thinks that that's actually normal, okay? But that is not actually normal. Do you get it? Uh-huh. So that's what we are actually trying to talk about, the toxic culture, sacrificing your future, sacrificing your health for, you know, all right. So please don't forget to share this video to your loved ones and friends. Tell them about OPJ HUB and the need for them to subscribe to this channel. So that's what we are going to talk about, the toxic culture, the toxic culture, toxic culture. Kindly let me know where you are listening or watching me from. So one of the toxic culture is stress. Yeah, stress. All right. All right. So someone is asking, Michael Cliff is asking, how. Oh, by the way, you are welcome. You're welcome. You're welcome. I really appreciate you joining the live section. I hope you are good. Yeah, yeah, yeah. So you are asking a question, and I think I would like to answer. Hey, how do operation of hernia takes place? And under normal circumstances, how long does it take to heal? Okay, all right, all right. So the hernia operation, um, one of the very important thing of the hernia operation is actually to close. There's an opening that is allowing the intestinal um, organs, or let's say the part of the intestinal part, or the part of the intestine passing through that hole into your groin, or sometimes your scrotum, sometimes into your groin. It depends on the level that you are stretched. It can go into your scrotum. So what they are doing is that they are just using a mesh or a kind of a tissue to block that opening, so that things inside the abdomen will not move into the scrotum. Okay, so let me give you a picture. Have you ever worn a trousers before where in the trousers is having a torn pocket? You see, when you put your hands inside, you can see that your hands can go deep, deep. Even one finger can pass through a hole into and probably touch your thigh. That's exactly what hernia is doing. So for us to repair the hernia, we need to sew that torn hole in the pocket. And once we sew that torn hole in the pocket, any money you put inside your pocket will not come out through the torn hole, probably, and enter into your trousers. Do you get the picture? So that's how it's done. Then um, it's a kind of a surgical procedure. Okay, you go in. It's simple. It's a very simple surgery. They'll just go to make an incision at your groin area, locate the place that is actually weak, and then you'll put the mesh there, and then they'll cover it, and then that's all. So then you ask, how long does it take to heal? Um, I sincerely don't know how long it takes to heal, but then what I know is that within some few weeks you should be healed completely. Okay, so once you had a hernia surgery, you book you for review, and yeah. So it should not take that long. It's not a let me say, it's not like a CS, or they have opened your abdomen completely and you are going to do an spiritual laparotomy. Hernia is not like that. Hernia is just an incision at the groin. So it's not like a very major surgery. Do you get it? So it will take quite some few weeks for it to heal. All right. Yeah. And apparently it's kind of the best to get it fixed as soon as possible, because if you want to take herbal medication don't really do anything. In fact, they will take your money, and then they'll just chop. Herbal medication don't do is the illustration I gave you, the torn pocket. Once they sew the torn pocket, that is all. Whenever you put your money inside, it will not move into your trousers. Okay, because hernia, what happens is that once they don't sew it or they don't close it, you realize that when you continue to cough, it comes out from your abdomen and goes into your scrotum or into your groin area. You understand? So that's when it begins to become uncomfortable. And usually we have risk factors for the hernia: increase in abdominal pressures, especially people who are farmers, or the gym, those who go to gym, who put pressure on the abdominal muscles and stuff. When they become weak, then the contents of the abdomen now moves from where they are supposed to be originally into the scrotum area. Okay, but the surgery is actually a safe surgery. It's a very safe surgery, so don't worry about it. Cry, you'll be fine. And I'm sure the people who do the surgery for you are very experienced, and yeah. even though there are some complications of the surgery that they may tell you, but most of the people I know who have had the surgeries are fine, are good to go. Yeah. So I hope I've answered your question on that. If you have any follow-up question, you can ask, and I'll be glad to answer that for you. Okay. Yeah, senior boss. I really appreciate you joining the live and asking your question. Yeah. All right. Thank you so much. Yeah. So I hope I've been able to answer your question. All right. But let me just use once as you are typing maybe your next question. I just want to add again that hernia is you know there are some complications of hernia if you don't get your hernia being fixed as soon as possible. There can be some complications that can happen. So you see, usually when it comes, you maybe you cough or something, or you are doing exercise or something very strenuous, then the hernia comes and goes into your scrotum or your groin area. Then sometimes you have to push it yourself manually. You have a way you just manually push it back into your stomach, or let's say your intestine. It will reach a point as it comes and goes, you push it back, it comes. Oh, okay, okay, okay. Oh, don't worry, don't worry, don't worry. Okay. Yeah, it is not something you should be scared. Okay. I've seen a lot of people come into the hospital to have surgery, and it's very safe. It's very safe. It depends on where you are doing it. Okay. So yeah, it depends on when you are doing it, where you are doing it. It's safe. I mean, it's even safe. I don't want to be very over, but then I can say it's even safe than even CS. Okay, yeah, it's safe. It's safe. It's safe. And once you have a very experienced person doing that, it's safe. So you don't have to be scared. Yeah, and it's the best. It's the best option. Once you have had your hernia repair, then now you avoid the triggers. What were some of the things that you think triggered it? You then avoid it. So don't worry, just go confidently. You come back and comment after I've had the surgery that it was a very successful surgery. Just that after the surgery, you have a little pain. That one is obvious, but then they will give you some medications for the pain and stuff. But apart from that, and these surgeries, they don't usually, you see, usually they say previously in the surgeries when they are doing surgery, they will give some medication to the person, and the person will go kind of lose conscious. But these surgeries are not like that. So you'll be conscious. You see, like in fact you'll be conscious. You will be feeling that they are doing the surgery on you, but just that they will numb you. So even if they are cutting you, you'll not feel anything. But then your eyes will be on, like you'll be conscious. Do you get the picture? So yeah, it's a very safe surgery. Don't worry, cry. So when are you having the surgery? When are you going to have the surgery? Are you going to have it this week? Mr. Clef, are you going to have it this week? Oh, okay, 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 okay. All right, sure. All right, that's fine. That's fine. So don't worry, you'll be fine. Okay. So there are some triggers as I've mentioned. Strenuous activity, heavy lifting of metals. Oh, okay, okay. All right, that's fine. That's fine. That's fine. Then I wish you the very best to your surgery. Yeah, don't worry, you'll be fine. Yeah, yeah. All right, sure. Yeah. So if I may ask, what do you think are some of the risk factor that caused you to have a hernia? What do you think? Could it be maybe you are a gym guy, or you exercise a lot, or kind of maybe the kind of work you do, you lift heavy things. Maybe you're a mason, you're a farmer. I don't mind if maybe you want to share something like that with me. The kind of work you do, like what are some of the risk factor that triggered what you're having? Yeah. Oh, okay, okay, yeah, 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 yeah. That's true. That's true. So apparently we have the ones in childhood. Okay, yeah. But then as you said, hard work. Yeah, hard work actually is one of the, because of heavy lifting and all those kind of stuff, they put pressure on the abdomen. You see, the abdomen is having muscles over there, and the muscles are like belts which protect the intestines and the structures within the muscles. Okay, so it's like you can see your muscles. That's why when people exercise them, that particular muscles, they get what we call the six packs. So it's a muscle. So but then when you do those um, tedious work and stuff, it puts pressure on the muscles there. Then the pressure inside the stomach or the abdomen become high. Okay, so it's increase, we call it increase intra-abdominal pressure. Now, once the pressure becomes very high, what do you think it will happen? There's no place for the pressure to move away from. So it will try to push the content against the walls of the muscles. And as the more as it continue to push the pressure against the walls of the muscle, the more you are also working very strenuous activity. Then eventually to get a place, it will break a certain area of the muscle, and then once it gets that place to break, then that becomes the pathway of which the intestine flows through. Do you get it? Part of the intestine flows through. So yeah, that's obviously the truth. So after the surgery, you have to make sure that if you think it's your work that is actually the problem, probably you can relocate, get a new job, a better job, probably that you will not really exert more pressure on the abdomen. Okay, so get a different job, or you can even tell your boss after the surgery that, oh boss, I had this surgery. Probably if you want to keep it private or something, you can tell your boss that, boss, okay, I have this thing that my doctor said I shouldn't carry heavy things again. So, or maybe you can even take a excuse duty from the doctor. Probably when after the surgery, you can tell him. Sometimes they can give you. It's not always, but sometimes they can give you an excuse. Excuse me. They can give you an excuse duty that you can tell your boss that, oh boss, for this number of weeks or months, I will want to avoid carrying heavy stuffs. Something like that. But if it's your own work that you are doing, that you have to now be lifting things, but what I would think is that maybe you can employ someone to do that whilst you pay the person, so you can safeguard your health as well. Or better still, you can get, if it's a lifting stuff, you can get some machines that can do that in place of you personally doing it. Do you get it? So these are options you can weigh around it and see how best you can fit it. uh, yeah, so yeah. All right. Thank you so much too. I really appreciate you joining. I don't take it for granted at all. Yeah. Thank you so much. Thank you so much. I really appreciate it. All right. So you can share this video to your loved ones and friends, and also don't forget to subscribe to this channel. I'm Dr. OPJ HUB, and every day we try and go on live, so you can join at any time to ask your questions and as well. All right. And I think I have a video on my channel, okay, on the OPJ Hub channel about hernia. You can search it out and then watch it, okay, as well, so you can get enlightened more on what hernia is all about. Thank you so much once again. Okay. Thank you. Okay, then I'm going to end the live now. Have a wonderful evening.